In pretty much any medical field, early detection is huge for the patients. And we've been visiting Dr. Soffer over the years as he's developed a device to help do that in his own practice. And now he's helping take that technology and make it more accessible to everyone. Let's go talk to the doctor. Dr. Soffer, good to see you again. What's new with the ThermPix device?
Well, now it's FDA cleared and it is being used all over the world. We've got it in multiple countries, used both in research and in the clinical capacity to be able to see things that we've never seen before with no radiation. It actually accepts the infrared temperature. It doesn't emit anything. So it's basically like taking a very fancy picture, but that picture tells us things we've never seen before, particularly on the legs.
How is this helping other clinicians that you've supplied?
So the ultrasound lab seems to be the actual bottleneck of most of the vein clinics, and this makes it more efficient, picks up more vessels along the way that need to be treated, and ultimately helps patients to understand and become more compliant during the process.
Now, is this something that's a replacement for ultrasound? Does it work in tandem with ultrasound?
It works in tandem with ultrasound. We have an FDA indication for adjunctive use. So while you're using an ultrasound, you want to get more out of your ultrasound, consider using the ThermPix device. It really makes the ultrasound even more useful. It helps us with mapping. So you'll find more vessels. The lab will be more efficient, probably about 25%, a little faster. So we can also use it periodically in screening and pre-screening before an ultrasound in health fairs and those sorts of environments.
Right, so this is even helpful for the other clinicians that you provide this to, because an ultrasound requires a tech and somebody to be able to understand it as well as operate it, whereas this is something anybody can check out and easily understand because it's a visual that's so obvious.
Absolutely. We think that within the very short, next few months to years, this is going to be possibly a requirement, certainly a huge advantage to ultrasound labs across the country because it makes them much more efficient with all of the mapping that is necessary. And this thermography works really well both standing up and laying down. So it makes for a more efficient use of the ultrasonographer and the ultrasound lab itself.
If people want to find out more, how can they?
So we have free screenings at the Soffer Health offices. We have offices in Dade and Broward County. And if people want to find out more about ThermPix, they can go to www.usatherm.com or they can go to www.thermpix.org. Either of those sites will take you and teach you more about thermography.
Well, Dr. Soffer, thank you so much. It's an exciting time, as you said.
Great. Thank you, Hunter.
You got it.